Are we live? I think so. If
Hi,
we are
everyone.
live and if you can hear us, please give us the thumbs up in the chat. Hi, everyone. Thanks for joining us tonight. I am Lisa. For those of you who don't know me, I am the co-host tonight, and I'm going to be helping Dr. Westman with all the questions that are coming in. We are live streaming into, I believe, 5 groups right now, so we will get questions from everywhere. It would be very helpful when you do have a question to start your question with a word question in all caps, followed by your question. That would just help me pick it up a lot easier in the chat, because right now the chat is kind of just going boom, 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 boom. So it really helps me to pick it up. But hopefully we will be answering all questions tonight. As long as they are not medical related questions. Of course, Dr. Westman will not be able to answer personal medical related questions because he doesn't know your history and he's not your doctor. But otherwise, we will be answering all questions. And before we start, I do want to let you know, in case you don't know, that Dr. Westman's course, Reverse Type 2 Diabetes, is open for enrollment right now. It will be closing tomorrow night. So if you do have any course-related questions, feel free to ask us those in the chat as well. And then we'll just be going through questions one by one as we get them. So I'll kind of just start at the top and work my way down. Are you ready to get started? Doc, you ready?
I'm ready as I can be.
All right.
You never know what questions will come.
All right, let's get through them. We'll dive right in. Is it okay not to eat if you're not hungry? I'm a 53-year-old female trying to lose stubborn 10% body fat. So much confusing info.
Yeah, there is a lot of confusing information, and I think it depends on the person, right? Or let's step back. If you're going to eat real food and be eating healthy in a way that supports your metabolism and which means protein comes first. When you think about it, we're made of protein. We're not made of fruit. So yeah, if you're eating a typical, we call it a low carb or keto, real food based diet, then you want to eat only really when you're hungry and not eat 3 times a day with meals. And that's kind of a flexibility that most programs don't give. A lot of programs will say you must eat this, and I've heard so many things that it really is misinformation, like you have to support your metabolism. I've heard that the breakfast is the most important meal of the day. I even hear people tell me, I wasn't hungry, so I forced myself to eat. No, please. Especially if you're trying to lose weight. I mean, we want you to comfortably eat less. And so I would say that, kind of, unless you're on medicines that mess everything up, you should drink when you're thirsty and eat when you're hungry. It's kind of like the basic of how to handle food and drink.
What is the calcium requirement on a dairy-free ketogenic diet?
Yeah, the nice thing about eating real food, meaning you eat meat, poultry, fish, and shellfish, and eggs, is you really don't have to worry about the fine tuning of how much of these things. And so as long as I get the food that you eat correct and right, the calcium, the magnesium, the sodium, the protein, the fats, it all just works itself out. So everyone really needs a different amount depending on their body and their metabolism. If you're 5 foot tall, you have different needs than if you're 6 feet tall. So I don't worry in my teaching about how many milligrams or grams a day of calcium. Sorry, I'm kind of vague on that one.
Lynn says, looking for advice help, T1DM with insulin pump.
Keto, right, so type 2 diabetes mellitus,
with
T2DM.
keto for 3 years, carnivore for 6 months. Best approach to calculate insulin to carb ratio. No carb count on most animal protein. I know I need insulin.
So now I'm confused. Was it T1DM or T2?
T1DM.
Okay, got it. So type 1 diabetes, which for those of you watching who don't know, type 1 diabetes is a insulin deficiency, meaning your body, your pancreas doesn't make insulin at all. And so you have to inject insulin in order to not have the blood glucose go super high. So when you're using an insulin pump, it's an individual thing. You're going to have to just learn carbs. You've cut out the major factor. And I would refer you to the great works and books by Dr. Richard Bernstein, and also there's another
Type 1
physician.
grit.
Type 1 Grit, the Facebook group, is also a supporting group to help you figure out. And I think there are rules of thumb to use to calculate the insulin need, but I think it's mainly trial and error. The other doctor with type 1 diabetes who wrote a book is Dr. Keith Runyon, Runyun, and Dr. Runyon and Dr. Bernstein have great books. And then the Type 1 Grit Facebook group is another support system for that.
If you've had a fallback for 2 days, what is the best way to get on track again?
Well, so interesting language. I'm assuming that you mean you had some carbs, you're doing a keto or low carb diet. Although on an AMA like this, I can't assume that you're following a low carb or a keto diet. So in further questions, please be specific. Assuming now that, let's say you ate some carbs, well, what that's going to do is stop the fat burning for a few days. Remember, when you eat carbs, you have to burn them. And when you burn carbs, it stops the fat burning. It's very difficult to burn both at the same time. That's why on a low carb keto diet, when you don't eat carbs, your body fat burns automatically for you. So the best way is just get right back on. It's like pretend you're starting over. And at the beginning, when I teach someone, it's kind of, I'm reminded of how I taught my children how to ride a bike. The first time they fell over, I didn't say, see, you'll never be able to ride a bike. No, I was supportive, and you just get back on. I kind of remember some days it was so disturbing that we had to just go home and try the next day. So kind of like that, once you learn how to ride the bike, you get back on and you stay on, then it becomes easier, and then you don't even need the teacher like me. So I am always reminded that I learned what I teach from my patients who did it reading books, and I didn't really teach them how to do it. I wasn't even that supportive at first. Now, 25 years later, a lot of people I know, you can take a course, read a book, and the best thing to do is just get right back on.
I'm type 2 diabetic on keto. Can insulin resistance ever actually heal, or diabetes heal?
Yes. So type 2 diabetes, starts with insulin resistance. It's also called glucose intolerance, which is a better term because it tells you what you're intolerant to, which is the glucose. And then over time, it progresses to type 2 diabetes. Type 2 diabetes can lead to trouble with the eyesight, the retinopathy or the retina damage, the trouble with the kidneys or nephropathy or kidney damage, and neuropathy, numbness and tingling in the toes. And then also it can lead to heart disease. So if some of those things have already happened, no, you're not going to be able to reverse all of those things, but you can definitely normalize the blood sugars, I'd say 95% of the time. And at first, the blood sugar will come down as you change the food, but then it might be the reversal of the weight and the insulin resistance from the abdominal obesity as the final cure of it. So yeah, absolutely, type 2 diabetes in most cases can be reversed.
What impact does dry red wine have on glucose, insulin, and metabolism? Occasionally, I have a glass or two, and my CGM shows a decline in glucose, but less stability a few hours later.
So I was going to say, you can find out your own response by using a continuous glucose monitor. Apparently you're doing that, which a lot of my patients are doing. In my area, you can't really get one through the insurance company unless you have diabetes. You can, with a prescription, get one if you pay for it yourself. A lot of patients are surprised when I pull out a book from 1923 showing the treatment of diabetes. The treatment included a little bit of alcohol in the very low carb diet, 10 total grams per day, and a little bit of alcohol, because as you noticed, in most people, it lowers the blood glucose level. So I think a little bit of wine or alcohol every day is consistent with a healthy lifestyle. 100 years ago, when they didn't have medicines, well, they used alcohol as a medicine to help lower the blood glucose. Interesting. You've figured out one of those things they knew 100 years ago, and then now doctors just pretty much give medications. That's the sad reality.
I've heard all about LDL not being bad as it has been made out to be. However, how does very high cholesterol fare? FH, I stopped taking it because I have type 2 diabetes, reducing carb intake.
Well, this is really kind of impossible for me to give personal advice there. In my clinic, we talk a lot about cholesterol levels and personalize the decision using other factors, not just cholesterol level, the risk. And remember, cholesterol is not a disease. Cholesterol is not a disease. What we're trying to do is prevent atherosclerosis, which is the vascular disease that affects the neck or the coronary arteries or any artery around the body. So LDL, I think, it still is an issue. It's a concern if you've had a heart attack or a stroke, and there's legitimate treatment of the LDL cholesterol and triglyceride in the blood and HDL. And a keto diet or lifestyle change, even other types of lifestyle changes, can help the LDL actually. And so I think the important point, and I know a lot of keto influencers kind of throw the baby out with the bathwater. I don't. I think it still is something to follow, and you want to check the triglyceride and HDL as well. The main message that I try to get out is that drugs aren't necessarily the only way to go about helping the blood cholesterol. Most doctors will be quick to write a prescription, and most guidelines talk about drug use for cholesterol management, when actually lifestyle can have a big impact too.
Can I do keto while on prednisone? I just found out I will always be on it, and everything I eat causes high blood sugar.
Well, if you're on prednisone, which is a steroid pill, it's one of the most potent factors that will make you hungry and raise the blood sugar and make you gain weight. So insulin being the other major factor, an injectable hormone. So steroids in any form, steroids up the nose, a medicine called Flonase. I see that stopping weight loss and raising blood sugars as well. Even a steroid implant into an eye for an inflammatory condition of the eye led to an elevated blood sugar. So of all the things you can do in the diet to manage the being on prednisone, a low carb diet is probably one of the best diets to do, because you're not increasing the blood glucose by the food you're eating as well. So while you're on prednisone, you may have elevated blood glucoses. but you can mitigate that response. Now, some people need to be on medicine for the blood glucose if it's high, very high. So that's, again, an individual decision you have to make. The last kind of steroid I see frequently raising the blood glucose is injectable shots into the knee and the hip. Who would think that a knee shot would raise the blood sugar for the knee pain, but that can as well.
Deborah says, is this class useful if you don't have type 2 diabetes? I'm interested in health.
Yes, I think so. The detail that we give about how the body works, I think, is useful for anyone, especially if you have diabetes in the family, for example, or just for general knowledge. We go into detail about drug treatment of diabetes, help you understand that. And then we give all the detail of doing a low-carb keto diet in order to reverse the type 2 diabetes as well. So yeah, I think it's not so pie in the or head in the clouds kind of thing. It's pretty down to earth. We want everyone to be able to understand what's happening when you eat carbohydrate, and some people can eat carbohydrate, but if it is contributing to type 2 diabetes, you want to be very careful about it.
What I would suggest you do is go to our website, adapt your, if you wouldn't mind putting it at the bottom, Doc, of the screen. But if you go to adaptyourlifeacademy.com and you go to the course page, which is Reverse Type 2 Diabetes, there's a full list, a full curriculum of exactly what we go through, what you're going to get in the course, as well as 5 live sessions, 3 of them with Dr. Westman, and then 2 of them with our lead keto nutritionist, Amy Berger. And all of those live sessions, so over and above your course lessons, I believe there are 20 pre-recorded course lessons with Dr. Westman inside of your own student portal, and then you get these 5 live sessions on top of that, so you can ask questions. And then, of course, in the course as well, we go through your body adapting, keto adaptation. If you've heard of, you may have heard of like the keto flu, but we go through the full food list. And so, yeah, so it's quite intense. If you've heard of our Keto Made Simple course, this one is that and more to do with type 2 diabetes. What is Jardiance, and is it recommended to help while following a low carb or keto diet?
Yeah, so there are a lot of medications that lower the blood glucose. Remember, diabetes is diagnosed by an elevated blood glucose or an elevated hemoglobin A1C, which is a reflection of 3 months of the glucose. It's diagnosed by an elevated glucose. So there are a lot of drugs that lower the glucose level in many different ways. You can stuff the glucose into the cells by using insulin or a pill that mimics insulin, enhances insulin. You can actually give a pill. These are Jardiance, Invokana. And what it does is it makes the urine leak glucose. I'm not a big fan of having you take a drug that leaks glucose into the urine. Well, for one reason, you could just stop eating the glucose so you don't have to have it leak into the urine. So most of the doctors in my area don't tell you not to drink sugar and stop the starch. They just give you a pill to do one of these things to lower the glucose, including putting the urine full of glucose. So the problem with that is the bacteria and fungi, these infections, also like the sugar in the urine. And so they can lead to urinary tract infections, in fact, can be quite serious. The other main thing is something called ketoacidosis, which the drug can cause, and they don't know why yet, the companies. It's not a good thing to have a side effect that you don't know why some people get it, because you can't predict or tell people to watch out. So especially in the context of a keto diet that you're already on, being on a medicine that increases your risk of ketosis and ketoacidosis is not a good idea. So I'm not a big fan of this drug, especially if you're doing a keto diet. So with my patients, if you were my patient, I would say don't use those drugs. And I, to the point where I would talk to the other doctor and say, we have other things to use. This medicine and other ones like it are being used for heart failure now. Remember, doctors think the only thing you can do for heart failure or for a medical problem is to give a drug. Actually, a keto and low carb diet can help reverse heart failure. And so, again, lifestyle can do a lot, and these drugs have a lot of toxicities now. And so I recommend, if you were my patient, to just be strict and not consume the sugar and the starch, because starch gets digested to sugar, rather than to take a pill that makes you leak it into your urine. That when I first heard about this, 15 years ago, I thought, this is not a good idea. And a lot of people do have side effects, serious side effects from those medicines. They're out there.
Are CGMs more helpful than A1C for showing insulin resistance and changing eating habits?
Well, so a CGM is a continuous glucose monitor. You can, like a little disc, put it on your arm, and it's painless, really. I've worn one. You put it on there, and there's a little catheter that measures the glucose every 5 or 10 minutes. You have your glucose level, and it will, with your phone or a meter, allow you to know moment to moment really what your blood glucose is. So if you're trying to test to see, I wonder if drinking a Coca-Cola raises my blood glucose. You could drink the Coca-Cola, measure your blood glucose, and you'll see the rise. Now, you could just take our word for it that drinking something like that is going to make the blood sugar go up. But, some people just want to see it for themselves. And so there's a very big difference between doing a glucose monitor that gives you, every 5 minutes a blood glucose level, and an A1C. An A1C gives you an average of 3 months. You check the blood once at the lab or the clinic, and you get a number, let's say 5.5%. That tells you over the last 3 months, your blood sugars have been in the normal range. Doesn't tell you them every moment of the day. And now if you're trying to look for pre-diabetes, you're going to be kind of buffeted. I've had some people be overly worried about just really minorly elevated blood glucoses. So it kind of depends. If you're someone who would obsess and worry if the blood glucose normal is 100 is the top, if you would worry if it went to 105, as some people come in and they tell me, oh, I'm worried about this, I say, forget about it. That's fine. And the A1C, still is like 5 and 5.5. So, you may want to temporarily wear one just so you get an idea of what foods to eat and not to eat. But on a low carb keto diet, you don't need to wear a CGM because the foods you eat don't raise the blood glucose. We've chosen those foods on purpose so that they don't raise it. So I don't recommend using a CGM, but even to my patients who come to me and in the class, I don't recommend that you measure the blood glucose or the blood ketones or the breath ketones or the urine ketones. If you follow the plan that we teach, it works without monitoring those sorts of things.
I was diagnosed with hypothyroid while recently going through menopause. Can keto and intermittent fasting heal my condition?
Well, so there are a lot of different kinds of thyroid problems. And in my experience, the weight loss and diet change doesn't really affect the most common types of thyroid problems. I don't find myself having to change thyroid medication over time. I do have to take people off blood pressure medicine. I do have to take people off diabetes medicines because it's obvious that these issues come to the normal range or even below. If you are monitored for thyroid and you're at the range where it's low or even, the medicine is too high, then you're not in that quite normal range, then you would want to adjust the medication and follow it. I don't think it's very likely that there'll be a change in the thyroid, but it's still important to measure it.
Fiber is good for microbiome. Some doctors say eat unlimited veggies at meals. Should they add unless you have type 2 diabetes? We're talking about doctors like Dr. Hyman, Dr. Lustig, Ludwig, etc.
Well, fiber is overrated for sure. And there are a lot of people that want you to take products and eat their products, supplements, things like that. I'm kind of an anti-supplement sort of guy, doctor, unless there's been a study that really shows that it's necessary or really that it has benefit. There's no question what you eat affects the microbiome, and the more fiber and more carbs you eat, the microbiome goes to town. I mean, it grows. And the way to reduce the amount of poop you have is to cut out the carbs. There's less poop. People go to the bathroom less often, and the converse happens. You start eating more carbs, there's more gas, more bowel movement. And so I don't think we really know the right answer for the microbiome at the moment. There's a tendency to want to say that if it's different, it's bad. So I do remember I was at a meeting where they showed a slide of a tropical rainforest, and the expert of the microbiome said, this is the microbiome when you eat carbs and proteins and fats. And it was like the tropical rainforest. Look how beautiful, all the colors. And I'm thinking to myself, well, they're also boa constrictors and spiders. And he clicked the slide and went to the next one, and he showed the desert. And he said, this is the microbiome when you don't eat carbohydrates. And I had just traveled to the Southwest United States and kind of felt the calm serenity of the desert. And he said that it wasn't beautiful, and everyone who lives in the Southwest United States knows the desert is beautiful. It's just a different kind of beauty. And this is what I see in my patients, is that you cut the carbs out, the microbiome settles down. And there was just a recent paper that irritable bowel syndrome, a paper in 2024, irritable bowel syndrome is best treated by a low carb diet. It was a randomized trial with 3 groups, well-funded kind of study out of Sweden. We published our paper in 2009 showing that a low carb diet would reverse irritable bowel syndrome. So I think adding fiber can be a problem, actually. And that's my long story to say, don't worry about the fiber.
Are metformin and semaglutide, is that how you say it? Semaglutide compatible with this diet?
Well, the diet alone is as strong as a drug. Dr. Yancey, my colleague at Duke, published a randomized trial in, I forget, over about a decade ago, where they compared a drug in a diet, orlistat at the time, to just the low carb diet. And the low carb diet was as strong as the drug in the diet. So you're adding, if you're going to use a keto or low carb diet, properly formulated, of course, you're going to be adding to medicines to a program that's like medicine. It's prescription strength. So sure, they're compatible, but you may have more side effects from one or the other. I have to say I've had more people on metformin and a low carb diet historically than semaglutide. Semaglutide is the generic term for the drug or related drug that's in Ozempic, that's in all the other ones, Wegovy, Saxenda, Zepbound, and Mounjaro are related to that. But just remember, if you're on those medicines and you can't find them, keto diets worked for over 150 years without any of those medicines. I just came from the Obesity Medicine Association in Denver. And of course, the drugs doctors are using them, but they're having a hard time finding them. And so now you risk that you get on it and then you can't find it. So if you get on a drug and no one taught you how to change the diet, this is a problem. So you always want to add a good prescription diet, or have the doctor tell you what to eat and not to eat, even when you're taking medications. So sure, they're compatible, but I don't typically use them. I teach just the diet, a prescription strength keto diet by itself.
Okay. I've heard you say the average person only has 5 grams of sugar in their bloodstream. How many carbs do you recommend per meal?
You tell me.
So we recommend.
So, of course, it depends on the person, and it depends on whether your insulin goes up to lower the blood glucose. Some people can eat 50 grams per meal and not have the glucose go up, but the insulin goes way up to keep the glucose down. So if you have insulin resistance, that means insulin is not going to lower it as fast or as well. And so you're not going to be able to eat as many carbs and not get a rise after the meal. When I teach people with diabetes that there are only 5 grams, and that's total grams, not net, in the blood, then what most people do is they gravitate, oh, I got it. They don't eat anything that has more than 5 grams at a time. What we teach is 20 total grams for the whole day. And we don't specify when you eat the carbs. So I guess technically you could have 20 total grams at one meal, knowing that still is more than that's in the blood glucose. But in the context of the whole day, it seems to work just fine. But that idea of the 5 grams, and that's an adult, mind you. A child will have less glucose in the blood. This is not taught in medical schools, and I think it should be. I mean, this is just basic physiology and understanding of what we're dealing with when we're dealing with an elevated blood glucose. I'm glad you remembered 5 grams.
Yeah, we've got
that was from my video. That was from my video for those who didn't watch it.
We've got to remember that, I mean, Dr. Westman's been live, I believe, since the beginning of April to raise awareness for type 2 diabetes. I believe that tonight is the 7th time. And if you go onto our YouTube channel at Adapt Your Life, you do new videos every week. So, but there are people obviously that are new and that have just heard about you. To those people, I would probably say if you are just getting started, either grab Dr. Westman's book called End Your Carb Confusion, and it's available on Amazon. Or if you can join us in this course, enrollment ends tomorrow. We would love to have you. We go through all of this inside of this course. It's a very intensive course, and you will have access to Dr. Westman and nutritionist Amy Berger. So please go to our website at adaptyourlifeacademy.com and check out the course that we have where enrollment is closing tomorrow, called Reverse Type 2 Diabetes. I think I asked this one. Did I? Is it okay to eat if you're not hungry? I believe I did ask that in the very beginning.
Yeah.
Okay. I followed keto, 20 to 30 carbs daily. Hard to get calories over 1,000, 1,100 for 9 weeks. Only lost 3 pounds. Clothes did not fit. My lab work is perfect. Jamie, that's a little bit of a loaded question. It really.
When I go into troubleshooting mode, there's so many factors to consider you really want to just talk to someone who's used this kind of approach for a while.
Yeah.
Yeah.
And also, you've been eating 20 to 30 carbs. Is that net carbs? Is that total carbs? We recommend total carbs. So there's definitely quite a lot. We don't go by calories. We don't ask you to measure your foods or to weigh your foods.
How tall are you? How active are you?
Yeah.
A lot of questions.
So we try and keep things very simple, and that's what works for us and Dr. Westman's patients and our students. Let's see. What do you think about very low calorie diet? Meal replacement shakes for type 2 diabetes. Is it too much sugar?
No, and in fact, there was a study in the UK where they used meal replacements, prescription strength, not the over-the-counter ones, but ones you would purchase from a doctor in the US. These are called OptiFast, MetaFast, Robard. Doctors sell them out of the office. And if you just want to drink shakes and eat bars for 3 months, you generally have to pay a few $1,000s for it. It includes medical monitoring. That's very effective at reversing type 2 diabetes as well. And generally, the carb content for the day is somewhere between 30 and 50 total carbs, but they're keeping the calories down at the same time. So that's where you can get away with more carbs if the calories are down. And not to confuse you, but actually the rice diet in Durham, I've been in Durham since 1990. It was in existence when I came to Durham, was literally rice, fruit, and fish, and it reversed type 2 diabetes because you only got 800 calories of rice, fruit, and fish. So this is where it gets confusing. If you're thinking, oh, you can't eat carbs, well, you could if you kept the calories low. Most of my patients want to be hunger-free, though. And in the context of a low-carb diet, the one that we teach, we don't allow the rice or the fruit. Hunger goes away, and it reverses the diabetes as well. But it's important, yeah, it's good to know, even weight loss surgery reverses type 2 diabetes, but it's pretty drastic. It's still kind of a harsh way to get you to eat less, to go in and make your stomach smaller. Some people need that, though. I guess then just to wrap up, you can do a program like ours, even if you've had bariatric surgery, weight loss surgery before. I've had a lot of patients who regain weight after, or even regain their diabetes after the weight loss surgery. And this kind of program is appropriate for that.
I did strict carnivore for 6 months. Why did I gain 10 kilograms and my waist is 2 inches wider? I now suffer from nocturia and on occasion bedwetting.
Well, I can't comment on those things. You can gain weight on a carnivore diet for sure if you eat a lot. So the calories are the guide for the whether you're going to lose weight or not. So I can teach someone to eat fat and to eat protein, do a carnivore diet, let's say just meat. But if they're eating a lot of meat, like calorie-wise, they can gain weight. So the ketosis is just the metabolism that happens. You're burning fat. You have to think about the fat store like your savings account. So if you're eating lots of calories of the fat, you're just going to store the fat into your savings account and you can gain weight on a carnivore diet. So I bet you didn't do the carnivore diet with a practitioner like me or so if you're watching an influencer getting information and it's not working, please ask to find someone who works with people in this space, because to me, that's wasted time. If you're taking the time to do it right, you should get results in the first 2 weeks. It's kind of my 2-week rule, that if what you're doing isn't working in 2 weeks, go on to something else. If you do a vegan diet, 2 weeks not working, go on to something else. Go on to something else, and then eventually you'll get around to what we teach, because it pretty much works for everyone. And so sure, I've had people gain weight on a low carb diet like the one I teach, because of habit eating, mindless eating. They're in front of the refrigerator going, oh, what should I eat? No. So yeah, there's a whole process to the behavior of eating, and then, you know, getting out and getting active, and that doesn't surprise me if you weren't watching the amount that you were eating, and if you were slathering butter on the steaks.
I was just going to say
I don't
that.
tell people to do that. And so always consider the context of the information you get on the internet. The internet's an amazing thing, and it's also a terrible thing. If you are listening to there's some gym person who's doing carnivore and they're slathering butter on their steaks, 150 grams of fat per day, that's not going to fix your diabetes. They're in the gym. You want to learn from a doctor who's been using this approach, who's helped, or someone who's reversed their own type 2 diabetes. But even then, if it's an individual who comes up with their own system of doing it, it's something that works for them. But you have to wonder, will it work for anyone else? So what we teach has been vetted and evaluated in clinical trials, and you know, really started 150 years ago in a diet book. So yeah, well, that's my long story. You know, don't go on too long without getting results. That's not my world. So I'm in an obesity medicine practice where if I don't give people results, they don't come back, and I don't have a job. So I have to do things that work for the most part. I mean, for most people.
What time will the live sessions in the course take place? So we actually have 5 live sessions, 3 of them with Doc, and then 2 of them with our lead nutritionist, Amy Berger. And we have 3 of them at 8 p.m. Eastern and 2 of them at 1 p.m. Eastern, so that because we have students from all over the world, but all of them are recorded. So you will get the replay the next day inside your student portal. So when you enroll in the course, you will get a welcome email and you'll have access to your own student portal that has all of your resources, that has the course, that has all of the lessons, the videos, etc. And then you will also get access to those live sessions and the replays to those live sessions, and you'll have ongoing access to that. Okay, when does enrollment close? It closes end of day tomorrow. That is May 6th at the end of the day. Please go to our website and you'll see that there's a timer up top there at the very top, adaptyourlifeacademy.com, and you can just check on, you can at the very, very top of the page, there's like a yellow kind of sky bar. And if you click on learn more or enroll now, it'll show you the whole course page and exactly what you get in the course. Okay. I have type 2 diabetes, eating really low carb, intermittent fasting. However, I noticed I go up 0.05 to 1.5 from pre-dinner numbers to the mornings. I usually end up getting in the 8 severe. I can't. It becomes garbled after that. So I can't see what you've read, what you've said, Jennifer. If you wouldn't mind clarifying. But does that sound? I noticed I go up 0.05 to 1.5 from pre-dinner numbers to mornings.
Well, I think that's using the units that are outside the U.S. Perhaps the blood glucose goes up after the meals. Well, depending on what you're eating, the blood sugar may go up. But if you're eating really low carb, total grams under 20 for the day, it really shouldn't go up after a meal. So cut the carbs down a little more.
Any advice for someone interested in pursuing a career in educating, helping others implement this way of eating, but who doesn't want to be educated through the current broken system?
Yeah, well, that's a part of my life. I'm on the board of the Society of Metabolic Health Practitioners. It's called SMHP. And it's a group of people who are trying to do this. You don't have to be a doctor. They can, there's a certification through that organization. Look up the Society of Metabolic Health Practitioners.
Lee says, can a person with pancreatitis eat a keto diet? I think that, Doc, I think you should specify, if you wouldn't mind, because if this person is on the internet looking at keto diets, there are different types of keto diets.
Right. So
So
it depends on which one you're looking at. If you had pancreatitis that led to hospitalization, which sometimes it gets that bad, I would consult a doctor who understands this way of eating, and not just do it on your own. If your triglyceride level is, say, 1,000 or 5,000, then you're going to want to have that monitored with any kind of program that you do. So I would think with any lifestyle change or lifestyle modification that's going to lead to weight loss or possible change in triglyceride, you would want to be monitored. Sure, with monitoring, you can do a properly formulated ketogenic diet. We really call it a protein comes first kind of diet, with a history of pancreatitis, but you want to be monitored.
RA is her diagnosis. They told her to never eat red meat. RA. Do you know what RA?
Yeah, so RA typically means rheumatoid arthritis. And, the data is kind of, I don't know if this is a scientific term, it's kind of wimpy. So not very strong for reducing red meat or even changing to Mediterranean diet. So it's interesting. The worry about red meat comes from people who really just don't want you to eat red meat for ethical and religious reasons. It's really not a scientific prohibition. And the randomized trials for any kind of arthritis or autoimmune kind of problem, the results are not very strong. You can change the diet, reduce the inflammation a bit. So a low carb keto diet actually reduces the inflammation in a more potent way than these other diets. And while there are no publications about low carb diets and rheumatoid arthritis, there are a lot of anecdotes of really good improvement, even reversal, that I don't see in these other clinical trials using other types of diets. So there's no guarantee that it will help, because what a clinical trial allows us to do is to say, let's say you take 100 people, how many will have results, positive results? You might 50% or 10%, or if you're just using internet information, you may see an anecdote or 10 anecdotes, but you don't know how many people tried it in order to get that anecdote. It might not work for even 1% of people if you're going by internet anecdotes. So that's the problem with using internet to base what you do. You may be following a very rare kind of thing. But I treat people with rheumatoid arthritis, lupus, ulcerative colitis, Crohn's. These are the kind of major autoimmune disorders, and many of them get better, not total reversal, but I would say it's worth a try. This is a more powerful kind of diet than a Mediterranean diet. Most people will lose weight when you do a low-carb keto diet without trying to lose weight. So if you have weight to lose and you have RA or these other autoimmune things, you can think of it as just a way of losing weight. And if that helps your other condition, that's just a bonus.
Is keto recommended for someone, or low carb recommended for someone with kidney stenosis who's been on high doses of blood pressure meds for over a decade?
Oh gosh, I think you might be referring to renal artery stenosis, perhaps. I don't know of any reason you couldn't, you would want to be monitored, like, again, like any kind of major change that you're doing. If you have a condition like that, you want to have the kidney function monitored as you do it. Sometimes it's not the diet that becomes the problem, it's the medicine that interacting with the diet that becomes too strong. Think of it like, so with diabetes, if you come in with, you're taking insulin that lowers the blood glucose, and you're eating all these carbs, if you drop the carbs on the first day, we need to reduce the insulin. Otherwise, the insulin will become too strong. So similar with something like a condition like renal artery stenosis, or if you have any medical condition requiring medication, you'll want to have some sort of monitoring at the same time.
Why do doctors so emphatically recommend Mediterranean diet but shy away from recommending keto? I find that people have much more dramatic results on keto, so I don't understand why they shy away.
Yeah, it defies rational explanation. I think because you can't really, the Mediterranean diet isn't one thing. You can't really put your finger on it. You can't say that it's bad, right? Because you can define keto, you can say it's either good or it's bad. And there was one study on the Mediterranean diet done in Lyon, France, not all around the Mediterranean, and it showed that you could prevent secondary heart attacks. If you watch any of my videos, the hallmark of science is replication. So until you get the second study showing that you can reverse or stop secondary heart attacks, we don't know for sure. So we're still waiting for that second study on the Mediterranean diet showing that it helps. And so, and yet, like you mentioned, the difference, the keto diet generally is stronger because you're getting the caloric reduction automatically, where a Mediterranean diet won't lead to that weight loss automatically. If you ever have friction if you're one of my patients, I coach you to go into the doctor and, oh, you've lost all this weight. How have you done it? I say, tell them you're doing the Mediterranean diet or a modified Mediterranean diet. The response is so different than if you say you're doing keto or high fat or anything. And then they won't ask you what you're eating and drinking, because nobody really knows what the Mediterranean diet is. I think another sort of historical thing that allows for just the Mediterranean eating to be more well established or more thought of better was the Ansel Keys study, which was done in the seven country study. Now we pull that study out as a bad example of science, and so I don't. And yet it has had legs and influenced so many people inappropriately. And then there's the blue zones thing, where people basically look and see what they want to see. Some of these places, they eat pork, and yet the plant-based folks say, see, it means plant-based is best. When so keto, I guess keto is stronger than Mediterranean.
Triglycerides. Can a 70-pound weight loss cause or temporarily cause high triglycerides?
Most of the time, the triglycerides go down when you reduce or eliminate the dietary carbohydrate. Occasionally, I've seen the triglyceride go up, but it's not very high. So now you're asking me, high or high, I need a number. And if someone talks to me about their blood glucose spiking, I always say, give me the number. I need the number. You can't just say spike. Someone told me their glucose spiked to 105, which is almost normal, So occasionally, I guess that's possible. And if it's not a very high triglyceride, I think that's fine, especially if the HDL has gone up at the same time. But if you watch any of my videos, I go from, let's not talk about just the blood levels now. Let's talk about the arteries themselves. Remember, cholesterol is not a disease. Triglyceride, well, I suppose if the triglyceride was 5,000 or 10,000, which is really high. Normally it's 150. So you could actually get pancreatitis from a triglyceride that's 15,000. That's an instance where you might even put someone in the hospital and watch them and fast them to get the triglyceride down. So again, I don't know where you are talking about your high triglyceride.
Is this the same course as the original Keto Made Simple course? So I know you've answered that before. Let me go through how it's different. So this course is laser focused on type 2 diabetes. So Dr. Westman's teaching is more in depth, specifically about blood sugar regulation, and this course covers much more detail about diabetes medications and how to safely reduce and eliminate them. So you are definitely going to learn about weight loss, insulin resistance, and the keto food list and everything else that you learned in the Keto Made Simple course, but it is laser focused on type 2 diabetes.
Yeah,
Am I right, Doc? Is there anything more you want to add to that?
Well, we've learned through the last few years, teaching people over the internet, that internet keto introduces all sorts of weirdness that doesn't happen when you do it keto the way that I teach it. The reason for that is I didn't create the program. I borrowed it from doctors who were using it 20, 25 years ago, and then studied it and kept perpetuating it. So, for example, we erase a lot of the internet keto weirdness, like the drinking of butter in the coffee. Someone came to me once, saying, "Well, I like keto, but I didn't like all that expensive food." No, you don't have to eat expensive food. And anyway, so I just want to say that we've learned a lot about how to correct a lot of the things to get it start working. And it works especially well with diabetes as well. So it's a similar kind of teaching, but getting the extra add-on information to understand what diabetes is, what that system we're involved with the 5 grams, and then how to get off medicine safely if you need it.
Apparently, I didn't read. There's a super chat question completely to Dr. Westman. So if you can, that is from Low Carb, Low Drama. Let me see if I can go back up and see what that question was. The only question I see here is, what's the calcium requirement on a dairy-free ketogenic carnivore diet? That's the only question that I see. If you want to just, if there's more to your question, if you want to just post it in the chat right now, then I can read it again. Okay, I just got an LDL reading of 623. I have healthy 101 HDL and 83 triglycerides, and I am lean, a 58-year-old male still. Don't worry should I not worry even at over 600 LDL?
Well, I'm not sure. And I was worried with someone with an LDL elevation 25 years ago, and you can see that I dropped somebody, took them out of one of our studies because of the LDL elevation. Over the last 25 years, the reduction of LDL and focus on it instead of the focus on triglyceride and HDL, which at the same time has always been there, it was just de-emphasized, has not solved the issue of the atherosclerosis. So remember, cholesterol is not a disease. Yet I know most of the doctors in my area, probably your area, and especially if they're following guidelines, they'll be taught to handle a LDL as if it's a disease and treat it with a drug. So I would say the jury's out. And the reason I say that is there is a study going on right now from the Citizen Science Foundation where the people with a high LDL are being followed to see if they develop not just calcium, not just changes that are not important. They're seeing if they develop coronary artery disease, and so they're being followed over a year, and there's someone in that study who has an LDL of 580, and that person has followed it for years and had a 0 on the coronary calcium score. So what does that mean? If you're otherwise healthy, you have an LDL like that, I would recommend that you get some evaluation of the arteries. Remember, cholesterol is not a disease. You can get an ultrasound of the neck and the aorta. You can get a calcium score of the heart, and then waiting for the results of the study, I think is a reasonable idea. There's no LDL elevation that would put you in a hospital. Look it up. Ask your doctor. Is there ever a time when the LDL is so high you need to hospitalize me? No, there isn't. There is for triglyceride. So if triglyceride is 1,000 or 5,000 or 15,000, you go to the hospital, you fast, you get that triglyceride down. So this is one of the really interesting areas. It's very controversial, and yet data are being collected about it. And go watch my channel, look at, search LDL, look at this. There's a lot of very interesting debate about it at the moment.
Dale asks, is there a discount for former students of Keto Made Simple? Yes, there is, and you should have gotten an email. So please check your spam. Otherwise, please email us at academy@adaptyourlife.com and we can give it to you again. You would get a 10% discount. I think that's all for tonight. We obviously are not going to be able to get through everybody's questions. I think that there's probably about another 50 questions that we haven't answered yet. If you have any questions, if you are type 2 diabetic, or if you have prediabetes, or as we said earlier, if you just want to learn how to get healthy, I would definitely recommend our course, which is enrollment is open now. It's Dr. Westman's course. This course has been 2 years in the making. It is offered right now at $197. So that is a founding member rate. It is never going to be offered at that low price again. And enrollment closes tomorrow. Please go to our website and check it out. If you go to the course page, you'll see exactly what you get in the course, and you will be able to ask a lot more questions, because you will have 5 live sessions, 3 of which are with Dr. Westman and 2 of which are with Amy Berger. But I think that is all for tonight, and I really appreciate you all joining us. For those of you who are watching on the replay, as I said, the course ends enrollment tomorrow. We only send this to you tomorrow via email, so it's actually today for you if you're watching on the replay. So it's May the 6th, end of day, May the 6th. This course will not be doors. We are closing doors, and this course will not be available after that. So thank you, Doc. I appreciate it. And
my pleasure. And we're just trying to get more information out to you. For those who can't make it to my clinic, you don't have to be in my clinic. We're going to share all of the information as if you made it to the office, and we're here to help. My admins and my staff, they're handpicked. They've been through this themselves, and think of it as just a way to learn about yourself, maybe start or restart the health journey. And my main message that has been this month is diabetes is reversible. Type 2 diabetes, even type 1, can be controlled a lot better. And the whole message is that it's the carbs in the food that raise the sugar in the blood. It really is that simple.
Awesome. Well, we hope to see you in the course. And if it's not this course, we hope to see you in the next one. Thanks, everyone.
Thank you, Lisa.
Bye. Have a good night.
Bye-bye.
Bye.